Used it as an opportunity to educate and to encourage people to engage in self-examination and have the necessary preventative measures undertaken by themselves to keep them healthy and to spot things that happen as quickly as possible. And this is typical of her, as is the fact that she's been on the phone up to late last night and this morning. But I just want to say that I think the team that has led in the pandemic at the city, and of course it's been a very large team of hundreds and thousands of people across the city, but the core team here that made the important decisions, herself, Councillor Cressy, Chief Pegg, myself, City Manager Chris Murray, we have benefited all the way through by the professional and balanced advice we've received from her, the fact that she was prepared and quite patient about answering certainly the hundreds of questions that I had about that advice before accepting it, which I think I've done in each and every case because it was professional and because it was balanced. And I think that that contribution has been immeasurable in terms of the relative success that Toronto's had in the pandemic. And so on that basis, but also more on a personal basis for someone who is a colleague and has become a friend through all of this, I speak, I'm sure, on behalf of all of us here in just wishing her well and in sharing in her positive attitude with respect to the outcome of this procedure that she has. And we certainly look forward to having her back at work on December the 20th, though I will say yesterday that I encouraged her to take longer just to make sure that she's rested up, but I'm sure she'll be back on the phone even before December the 20th. We are, thanks to that effort made by her and the rest of the team, continuing to make solid progress getting Toronto residents of all ages vaccinated. On the kids front, if I can call it that, it is very gratifying to know that in just over a week we have administered to 5 to 11-year-olds in Toronto 60,000 doses, which represents more than a quarter of the population in that age group within the City of Toronto. Since the start of the campaign 2 weeks ago, the highest number of doses were administered this past Saturday, December the 4th, with almost 7,000 doses delivered to 5 to 11-year-olds that day. The second highest number of doses was the previous Saturday, and we look at all of these kinds of things because they help us to learn about where and when we should have clinics and to make sure that we make the vaccinations available at the time and place that is going to be most suitable to the largest number of people. Vaccine coverage, as you would expect, varies across the neighborhoods, with the highest coverage in the neighborhoods in the city centre, which is the same as what we saw for adults in the earlier going of that campaign. But Toronto Public Health is seeing some early successes in some of the selected neighborhoods that we have focused on. So, for example, Taylor Massey, that neighborhood has a 5 to 11-year-old coverage rate of about 25% right now, which is not far off the overall city average. So we're very gratified that the targeted outreach effort to particular neighborhoods seems to be having a positive effect. Well over half of the kids' doses delivered so far have been at the larger immunization clinics, the ones run by the City of Toronto and by some of the hospitals, about 66% in those locations, with pharmacies contributing to about 16% of the doses. I want to remind families that hundreds of pharmacies are indeed available across the city, and they have the children's vaccine so that kids can get vaccinated there, as well as at the school clinics, as well as at the city-run clinics or family doctors' offices. And for a list of all of those different opportunities to get kids vaccinated, I would suggest people could best go to toronto.ca to have a look for that information. So while we're making good and so far quick progress in helping kids get vaccinated, we also continue with the steady work of helping more people 12 and older to get vaccinated as well. When we launched Team Toronto's Vax the Holidays campaign in mid-November rather, our goal was to make sure we made vaccines available to people in convenient community-based locations, and it's been working. More than 1,600 doses have been administered at Vax the Holidays weekend mobile clinics in malls and in schools and in community centres, and this has helped people to, up to this point, we had been found somewhat difficulty in reaching. With the colder weather and confirmation of the Omicron variant in Ontario, it's vitally important for people who haven't received their first dose or their second dose to get them as soon as possible. And we want eligible residents to get their boosters as well. And appointments are available in all of those cases for those who are eligible. We anticipate a large number of shoppers will be in malls this weekend next, and so that we're continuing to make it easy for people to get vaccinated in key data-driven walk-in Vax the Holidays locations. So thanks to our location partner RioCan, for example, they're hosting vaccine COVID-19 clinics this Thursday, Friday, and Saturday at the Lawrence Allen Centre, the Stockyards Village, and the Young Shepherd Centre. And those are all in locations where, in some cases, people can easily access them by public transit, but in others, they will happen to be wandering by in the mall doing their shopping or just out for a visit and can get vaccinated. On Thursday, community-based clinics are open at the Broadlands Community Centre, the Canoe Landing Community Centre, the Oriole Community Centre, and the St. Albans Club. And on Saturday, clinics will similarly be open at the Thistletown Collegiate Institute, the Waterfront Neighbourhood Centre, all of those clinics have hours that vary. So again, my suggestion would be that people who are interested go to toronto.ca/COVID-19, and all of this information can be found there. Specifically for children 5 to 11 again, Team Toronto Kids is operating 23 school-based clinics from Thursday to Sunday through the Toronto District School Board and the Toronto Catholic District School Board. And of course, there is the highly anticipated Toronto Kids Vaccine Day this Sunday, December 12th, at the Scotiabank Arena. It's not too late to get the 5 to 11-year-old superheroes in your lives to be a part of this event at the Scotiabank Arena. And again, as part of what we've been doing throughout the different clinics to make these experiences kid-friendly for the young people, this will be a superhero-themed mass immunization clinic at the Scotiabank Arena in the home of some of our greatest sports superheroes. Toronto Kids Vaccine Day will make sure that children feel safe and feel relaxed and have a sense of fun as they get their COVID-19 vaccine. So they will be greeted with a superhero vaccine clinic passport that they can get stamped as they go along. It includes the details on the 4 stops along the way to register and otherwise that people have been through, and it also helps them to navigate and to understand their navigation experience with custom stickers for each station for the kids. I've seen in my own visit to a couple of these clinics immunizing the kids that it actually does work. It amuses, it distracts, and it does a lot of things that I think just help the kids to be more comfortable, and their parents, with this experience. At the Scotiabank Arena on Sunday, when the hours are from 10 a.m. to 6 p.m., we will have the Toronto Fire Truck, we will have Blinky, the Toronto Police Car, to greet kids and their families. Inside the clinics, we'll have the mascots for the different teams, Carlton the Bear, the Raptor, Stripes, and Duke the Dog, which are, of course, Paw Patrol characters, and Sky, Toronto's first responder mascot, Sparky, the fire dog, and so there'll be lots there to keep kids amused and hopefully a bit distracted as they go through the vaccination experience. And there's coloring sheets, interactive activities, selfie stations. So we really have tried to make sure that it's something that can be fun for kids, top to bottom, with the kids themselves in mind. And there'll be giveaways, and this can all be accessed again through the provincial booking site that people have used thus far to get an appointment, and appointments are still available at both the city-run immunization clinics and at the Scotiabank Arena for the activities this weekend. Our work to reach out to residents through VaxTO is going strong. Later today, I'll be recording a call that will go out to 500,000 people advertising upcoming town halls on vaccine for kids, because we know that, with a quarter done, that's a good accomplishment after just over a week, but there's lots more left to be done for kids and adults. And so we're having these town halls on vaccines for kids. We're letting them know through these calls about information on vaccine booster eligibility, and offering to help people who aren't vaccinated as yet to get vaccinated. And this is another example of the outreach work we've been doing for some time now with all of our ambassadors and other people as part of our Team Toronto effort, because we are not leaving any stone unturned at reaching everybody everywhere across the city and encouraging all of them to get vaccinated. And we are inching closer and closer to our 90% goal, and that is how we're making the progress these days. But we're not in any way diminished in our enthusiasm about that, even though each dozen vaccinations comes with a bit more effort. It is nonetheless happening. The holidays, of course, are fast approaching, and I'm delighted to discuss Toronto's New Year's Eve plans, which we're making dutifully, but in a safe and responsible manner, sort of different and better than last year, but not quite back to what we would have done in many previous years. And we'll have to see if some of the things we're doing this year actually turn out to be things that we'd like to continue going forward. But to ring in 2022 and try to make up for the shows we missed due to COVID-19, we will have an unprecedented fireworks show at midnight on New Year's Eve, but there will be a big difference in how it's actually put on. The city staff have been planning a high-altitude fireworks display that will be launched simultaneously at midnight across Toronto's waterfront, and that allows it to be dispersed so that we don't have one big crowd gathering here at Nathan Phillips Square. It will be viewable from Etobicoke to Scarborough, anywhere across the city that has a view or any proximity at all to Lake Ontario. The fireworks display will mark the beginning of 2022, a year in which I'm confident that our progress bringing the pandemic to an end will continue and that the city can, in fact, come back stronger than ever. Ahead of the fireworks, the city will have a 90-minute New Year's Eve live stream hosted from the CN Tower observation deck with a mix of live and pre-recorded performances from iconic Toronto music and performing arts venues across the city. The free live stream broadcast will be available on the city's Culture TO YouTube channel. Our economic development staff have worked with Toronto Public Health to make sure that this can be done in a way that is safe, but represents, as we've been trying to do in every area, something that is between last year's rather stark, lonely experiences where people couldn't be with each other at all, to something that goes partway on the return to normalcy and that at the same time is safe and responsible for people across the city. As I mentioned, this year's festivities feature significant fireworks displays across the waterfront to allow for a bigger show and for safer enjoyment for all. The fireworks will also be included in the live-streamed broadcast. The full lineup for New Year's Eve details will be announced on Tuesday, December 21st at toronto.ca/New Year's Eve. In the meantime, the Cavalcade of Lights show continues here at Nathan Phillips Square with a month-long display of enhanced lighting installations and the city's almost 18-meter tall Christmas tree, and that will be available for the public to enjoy until Friday, January the 7th. The public can also explore tunnels made from thousands of energy-efficient bulbs, discover glowing ice sculptures, although I saw that the warm temperature had taken a bit of a toll on those on television this morning, and participate in an enchanted forest, an LED light show on City Hall, and public ice skating, which many people have been taking advantage of. Local business improvement areas across the city have also participated in the Cavalcade of Lights to bring the magic of the holiday season to our neighborhoods and to emphasize a message that I've been trying to convey over and over again, and I'm sorry if it's a bit repetitive, but I think it stands to be repeated. I want to encourage people right up to and including Christmas Day and Boxing Day and beyond to shop local, to buy local, and to dine local. We are seeing lots of reasons, mostly occasioned by the pandemic, why these businesses have been struggling, but they're getting back on their feet. They're open for business. They need your business and they need your support. And I hope people will take advantage of that opportunity. And it's going to be reinforced by our Show Love TO campaign, which will be releasing a new ad today on social media, encouraging people to shop local. I had quite an experience in participating in the production of that ad, which people will see soon enough. I want to thank everyone for continuing to show love to local shops and restaurants because they have been doing so, and it's something that is a good act of collective solidarity with our small businesses and our small business main streets across the city, which are so important to the well-being of our neighborhoods. The New Year's Eve celebration and the extension of the Cavalcade of Lights program are in partnership with Show Love TO and with the local BIAs and have been funded in part by the Government of Canada through the Federal Economic Development Agency for Southern Ontario and by the Government of Ontario, because they recognize in the spirit of the kind of partnership we've had throughout the pandemic that helping these smaller businesses and main streets get back on their feet is an integral part of a strong recovery for Toronto, which has benefits to both the province and to the country. And it's another example of how we've been working together, as we were doing this morning at the waterfront, to help Toronto to come back stronger than ever. I know that we're all looking forward to an exciting new year, and one that is even more positive than some of the positive things that did happen this year, and that we'll be able to see the city coming back together stronger than ever in 2022. And I hope people do enjoy the fireworks across the waterfront and the broadcast from the CN Tower as part of ushering in, hopefully, what will be an even more positive 2022. And so on that note, we do have available today Dr. Dubé, who can answer questions specifically as regards COVID matters that Dr. Davila would have normally addressed. And we have also officials with us from the Economic Development Department who can expand on the New Year's Eve plans if you require any further detail. And of course, I'm available to you now on any other matter to do with City Hall or the city. Lavin?
Thank you, Mayor Tory. We will now take questions from the media. As a reminder, it's one question, one follow-up. So first up, we have David Ryder from The Star. Go ahead.
Good morning. Good morning. My first question, I think, for Dr. Dubé. When I look at the map of the areas with the highest and lowest COVID in Toronto now, it seems a big shift from the early days when it was so concentrated in Rexdale to the northwest and Malvern to the southeast, including, it seems like, in higher income areas now. Can you speak to a little bit about that, understanding that it changes from week to week? Has TPH noticed a shift in the patterns of where we're seeing the most infections?
Yeah, thank you for that question. I think there certainly have been changes in the epidemiology of COVID-19 in Toronto, most notably that children now have the highest rates by age of COVID. And so some of that shifting that we're seeing in the geography may also be related to who's actually getting COVID, meaning the children. And as we start to see more children vaccinated, we may again see different ways in which COVID is spreading geographically in the city. So that there are certainly a number of reasons why certain neighborhoods in the city may have different reflections of COVID activity compared to previously. Because as you recall, previously it was often based on essential workers, the newcomers, those who had worse social determinants of health. And so that the change now with children being more likely to get COVID is probably also a reflection of where COVID is more likely to be found in the population.
Thank you. And my follow-up, I think, will also be for Dr. Dubé, and that's, we heard a little bit from Dr. Moore yesterday about advice for what people should and shouldn't do for holiday gatherings. I'm hoping to hear from you what is considered safe and not safe this holiday break for a lot of people. You know, should it just be immediate family? Should it be our friends and family? Okay, what's your advice on safe gatherings?
Yeah, we are absolutely working on guidance messages out for the public on this because it's really important that we take the precautions that we need to take because, as you know, our rates are going up. We have to remember what our provincial regulations are, no more than 25 indoors and 100 outdoors. 25 indoors may be too many if there are vulnerable people like seniors who are at a gathering, or if there are many who are unvaccinated, not fully vaccinated, including children. So our recommendation would be, of course, to avoid the 3 Cs, crowded conditions in enclosed places with too many people around. If you're having indoor gatherings, make sure that the windows are open, that there's enough room for physical distancing, and have smaller gatherings as well. But we certainly want to prevent spread. We know that COVID is spreading now among a lot of those person-to-person interactions that are occurring. And we know that family members don't choose to give COVID to other family members, but just because they're related to you doesn't mean that they may not be contagious at that time. So I think it's really important for us to reflect on how we choose to celebrate the holidays and to really take those measures. You know, have an outdoor activity. We know that outdoors is safer. We know the weather may not always cooperate, but you know, meeting up to go skating may be the safer option than having an indoor gathering, for example.
David, I'll just, you know, I asked Dr. DeVille about this a few days ago, and I've just been repeating over and over again the advice that she offered, as I often do, because I know it's coming from, you know, a professional like her and like Dr. Dubé. And she said, you know, very simply this: people should be careful about how they socialize, how many people, you know, where it is, about the ventilation, about the proximity to one another, compared to what they might normally do. It's going to be better than last year because last year a lot of people were by themselves, maybe 1 or 2 people, and then they should be careful who they socialize with. And that includes consideration for vulnerable people, and it includes, you know, people who are sick who should stay home. And that's been the advice offered through the pandemic. And so we're just asking people to think very carefully about how they socialize, because it's not back to normal, and who they socialize with. It's not back to normal, but it is better than last year. And I think if we, you know, watch things in that manner, it will cause things to be in as safe a manner as could be the case in 2021.
Okay, that's actually it for today, everybody. Thank you and have a great rest of your week.
Thank you.